Can you see the slide?
Not yet, sir. You can click share screen. Yeah,
Yeah, now.
yeah. Now we can see.
Once again, I would like to thank Dr. Sriharsha for the presentation, the opportunity for giving me this opportunity. This is the first lecture in the series of rhinoplasty webinars. This will be a basic presentation, a few concepts, few things, how to start rhinoplasty practice, how to prepare yourself for rhinoplasty. This will be a basic presentation. Okay. Later on in this series, we will choose particular deformities or particular topics. For example, pediatric septoplasty or something like rhino or radiology in rhinoplasty, something like that. We will do it in the next subsequent lectures. Okay. This is my hospital. It's located in North Bangalore. Uh, I do more of rhinoplasty work. I'm practicing since more than 15 years now. Okay. Next slide. Most of the audience are, I think, ENT surgeons. Any other specialties there, Sriharsha?
Mostly ENTs only.
Most of the, I think, most of the audience are ENT surgeons. So we have to understand that the trend is changing, right? So you earlier when we were doing undergraduation or post graduation, very hardly few rhinoplasty surgeons in India. Now the nowadays the lot of workshops are going on and there are a lot of fellowship programs are going on now. The open septorhinoplasty, I feel it is a basic procedure nowadays. You must just like tonsillectomy or septoplasty or any other ear surgery. I feel one must master the open approach septorhinoplasty as well. Okay. Next slide. As we all know, we operate as a ENT surgeon. We operate in and around the nose. We do septoplasty, turbinoplasty, endoscopic sinus surgeries, polypectomies, adenoidectomy. We operate almost all around the nose. Why not rhinoplasty? You can have a teamwork. You can have a team. You can have a team with the plastic surgeon or maxillofacial surgeon in your practice area or in your hospital, and you can do rhinoplasty. This is my opinion for the beginners. That's where the concept of interdisciplinary approach comes. You have to have a team with plastic surgeon, maxillofacial surgeon, dermatosurgeons, or dermatologists. You have to have a team so that the patient will get a good results, as well as you will have good patient base. They will refer you and you can refer the patient. So in that way, you will have a good rapport with the other specialty that will lead to an interdisciplinary approach, and you will get good number of patients as well as good results. Most of the time, as a ENT surgeon, you do septoplasty as a routine, as a conventionally, you do septoplasty, and that is a basic procedure. When you are a resident or when you are doing routine work, one or two cases will be there in the OT list, right? So you have to upgrade to rhinoplasty when there is a nasal valve obstruction. There is an internal nasal valve or external nasal valve obstruction, or there is an anterior deviation, that is a caudal dislocation or superior deviation, keystone area deviation, or external valve obstruction. These are the scenario or situation where you can upgrade from septoplasty to rhinoplasty. Okay, so don't do only septoplasty when there is something like a caudal dislocation or keystone area. There you may land up in failure, or again patient will come back with a similar problem or same problem and saying that there is no help by the surgery. Okay, this is the picture. I think you can all see the picture. Hello, Sriharsha.
Yes, sir. We can see,
Yeah,
sir.
can you? Yeah, this is the picture, the line diagram I'm showing here. This is the L strut. When we do septoplasty, most of the time what we do, we will remove the posterior inferior part of the septal cartilage, or we will remove the bony cartilage here, bony septum, the perpendicular plate of ethmoid or the vomer bone or the maxillary crest. That is where you get the spur. So the topic, the concept here is you have to preserve the L strut. I have seen many revision cases. I have seen many septoplasty, post-septoplasty cases coming up with nose block. There will be a deviation, there will be a crooked nose, or there will be a tip drooping. There will be alar reduction, alar widening, or columnar retraction. So these are all the complications I have seen after septoplasty. Why there is a complication, such complication? Because you will not, when we do septoplasty, we have to preserve the L strut. When you don't preserve the L strut, or you damage the keystone area here, somewhere here, or when you cut the cartilage somewhere here by crisscrossing, or you just having a cut on the cartilage, this cartilage will become weak. And I've seen the anterior nasal spine is attached to the septum, caudal septum. When there is a separation, or when you cut this part of the septum, you resect this part of the septum, then there will be a tip drooping. When there is a tip drooping, the patient will come back with a nose block because there is a valve obstruction, and the patient will have tip drooping, and the patient will have pseudo hump. And there are a lot of other deformities that will lead to, again, patient will be dissatisfied, or patient will have similar nose block. Then patient will come back to you saying that there is same problem. There is no use by the surgery. So why this is the you have to understand this concept is you have to preserve the L strut. You have to harvest only the posterior inferior part of the septum, septal cartilage, and you can remove the bone. Nothing will happen. But if you damage the L strut, then you are going to be in a trouble. Next, coming to the branding and marketing. This is a important thing in rhinoplasty. When you are a rhinoplasty surgeon, you must understand this concept of branding and marketing, because many of us we are not doing, because we don't know. Even I am also not well versed with the branding and marketing. Nowadays, I am just thinking of it. Almost 15 years of my practice, just doing my work, and I was not aware of these branding and marketing. Nowadays, I have started my own website. I have started my own Insta page, YouTube channel, Facebook page, blogs. So all these are you can do it as a, if you are a tech savvy, if you know about these social media channels or social media network or the platforms, it is easy to do it. Okay, so you can have your own website, and you can write your own articles, journals, and you can record your videos, and you can publish, or you can present in YouTube. This is going to give you branding or publicity. Similarly, there are other methods of branding and marketing. As a rhinoplasty surgeon, if you want to do more and more cases, you must have to have your own branding. You have to brand yourself by doing webinars, seminars, fellowship programs, associate with other societies, and create your own network. This is something different. This is something different, which most of the doctors, we don't do it. It needs a lot of interpersonal relationship. It needs a lot of energy and time to make all these kind of activities. But this is also one of the method of doing branding or marketing, right? So you have to have a good patient base, and you should have a good to follow up with the patient whenever you operate. You keep calling the patient for follow visits. Don't charge them, and the patient will come back and you take photographs, keep it in your laptop, and you have to wait for a few years to develop your own rhinoplasty practice. Then the mouth to mouth publicity also will help to get more and more patients. So this is my brand, this is my logo. So most of the hospitals will have logo. Similarly, you have to, if you are having your own clinic or your own hospital, better to have your own logo. And you go wherever you go and show this logo whenever you present your presentation in your seminars or in a conference or anywhere, you show it. That's how you can develop your brand. This is important in rhinoplasty practice. Okay, then coming to the marketing. These are all important because just like that, you will not get rhinoplasty cases. Rhinoplasty patients also, they are very, very smart. They will see in the social media, in the digital medias, and they will check who is good and who is doing good work and who is having good results. So all these branding and marketing parts are very, very important. These concepts you must understand. If you are a beginner, if you are doing good work in rhinoplasty, you want to take rhinoplasty as your career, it's very, very important. So if you want to start your own office, it is better to have a good location for your hospital or your clinic or your office. The location should be downtown in the city. Ideal situation. It should be ideally, it should be in a good business location. Maybe something like in Hyderabad, like a Banjara Hills, something like that. So it should be a good business hub, business area to have a good rhinoplasty clinic. Then only a patient will identify, okay, this hospital is in a good location. So they think like that. You may be a good surgeon, but if you are not in a good location, patient may not come to you. Similarly, your office or interior is also important. If your office is good, the ambience is good, if the aesthetics of your hospital is good, then they feel it. The patients or the clients will feel it. Okay, this is a good hospital. Then the conversion rate will be more, and the patient will convert into surgery. If they come to your hospital, if the ambience is good, and if the presentation is good, then patient will convert to the surgery. So that is also important. And then you must have very good reviews, website, photographs, videos, all those things I've already explained. So these things also will fetch more number of patients, and you can increase the number of patients, and you can develop your rhinoplasty practice. Suppose if you are not having your own hospital, if you're not having your own clinic or your own setup, then there are other options. Like you can join to any other corporate hospital or any other high volume hospital, but it will have its own adverse or pros and cons because you are not the decision maker. So you have to depend on the management to do something, any workshop or any work you want to do, to buy an instrument. So many other things will be there in rhinoplasty practice, which sometimes it is difficult if you are attached to some other hospital. Uh, but you can have other advantages of big hospitals. You can make use of it. So, and then you can associate with your seniors, your other team members. You can have a team and you can do practice, and you can develop rhinoplasty practice. The next slide is showing Dr. Rod Rorich. He is a US rhinoplasty surgeon. He has done MSc and then MCH plastic surgery. So this doctor is a very good famous doctor in US. He always says there are 10 P's: passion, perseverance, positivity. All these points he mentions. When you want to develop rhinoplasty or facial plasty as your career, you have to have passion, perseverance, positivity, purity in your work, persistent patience, point driven, persuasive photography skills, and passive income. And I believe in Japanese concept called ikigai. Ikigai is a Japanese concept. It explains the purpose of life. So I always think, wow, I do a rhinoplasty because I love rhinoplasty, and what you are good at. I am good at rhinoplasty, and what you can pay for. The patients pay for rhinoplasty, and what world needs. Yes, the world needs good work, good nose, good looking nose, and breathing nose. So rhinoplasty is my purpose of life. So you have to find out your purpose. You have to find out your speciality, your uh, work. What work makes you happy? What work makes you fetch you more money? And what work that will give you more energy to do more and more work? So you have to find out. So I found rhinoplasty as my ikigai. So now I'm doing more and more cases, and I'm happy with the rhinoplasty work. Okay, go to the next slide. Okay, now rhinoplasty as a career. It is very, very rewarding. So this is all these slides are for the beginners, postgraduate students, or the those ENT or plastic surgeons who want to take up rhinoplasty as is their career. There will be challenge. Definitely, there will be immense challenge when you see a patient of rhinoplasty. They will have a lot of requirements, expectations, but it will be remarkably rewarding. If you get a good result, then patient will be happy and he will send more and more cases. So you have to have a thorough interaction with the patient. You must understand the requirement of the patient, and you can do a carefully planned, well executed surgery. And if you do closed follow up, repeated follow up, then you can give good result, and it will be a more rewarding. And definitely rhinoplasty is a good area to develop, and you can practice rhinoplasty as a rhinoplasty surgeon. For that, what do you want? So if you want to take up rhinoplasty as your career, what are the requirements? You must have a good training. So training also important. Maybe in your residentship or in your post graduation days, you may not able to see more number of cases. But after your post graduation, you can go to. There are a lot of training programs going on in India and outside India. You can join any rhinoplasty surgeon, senior surgeon, and you can work with them for few weeks or few months. Or I have worked with my professor Jung for more than 1 year. Usually there we used to operate 4 to 5 cases per day. Uh, so that is a high volume center where I used to get cases from different parts of the world. So like that, if you do more and more cases, more and more cases you assist, you do, then you will be getting more uh, information or more training on the rhinoplasty. You can do rhinoplasty surgeries after your fellowship program. Okay, so this is a well-structured training program. I did my fellowship in South Korea. This is Professor Chung Dong Hak. I did my fellowship in 2009 in Simian Rhinoplasty Clinic, Seoul, South Korea. There, I had a structural training program. I used to observe for 6 weeks what they're doing, how the system going on, and how the clinic is running, and then started slowly doing suture removals. And then after 3 months, I started doing suturing, then started doing infiltration, and then giving incision, flap elevation. This is in a gradually after 6 months, I started doing osteotomies. then cartilage suturing, tiplasty, like that. Okay, after 6 months, I was allowed to do from incision to the closure. Then later, after 6 months, I started doing other procedures like rib harvesting for reconstruction work, and other facial plastic surgeries, other reconstruction surgeries, and then vascular collapse. So this is how my training was there in Shimi and Rhinoplasty Clinic in 2009, 2010. So in 1 year, I did more than 1,000 rhinoplasties, and that is, I am blessed to have a mentor like Dr. Professor Jung Dong Hak, and he allowed me to operate, and he used to take me to other countries like China, Philippines, Taiwan, and other Asian countries to assist. I used to assist him as a scrub nurse. I used to prepare the trolleys, I used to prepare the instruments, I used to wash the instruments, and I used to take care of the instrument and consumables. This is how I learned rhinoplasty with my professor Jung Dong Hak. That the learning curve is also important. This concept of learning curve in rhinoplasty, it is it is mainly if you are if the numbers are more, then the learning curve will be faster. You will learn, and if the numbers are persistently, you are doing the cases like once in a week or once in a month at least. If you are doing rhinoplasty every once in a month or once in 2 weeks, fortnight, or once in a week, then you will be having touch with the rhinoplasty instruments and the skills and the steps. Then it will be easy to develop your skills, increase the skills, and you can do from septoplasty, you can do open approach septorhinoplasty, and then you can do cosmetic rhinoplasty, and then you can go for reconstruction rhinoplasty. The peak will be reconstruction rhinoplasty. If there is no nose, you can create the nose by harvesting the rib cartilage, costal cartilage, and you can take a forehead flap. All those things we can do. So that we will discuss in the next upcoming seminars, lectures in the rhinoplasty master class. We will start now. This is the first lecture, so I'm just going to the basics. So as the days, as the this program goes on, then we will select a functional rhinoplasty, functional septal rhinoplasty as one day's topic. Cosmetic rhinoplasty we will take up as one lecture. Like cleft lip rhinoplasty, cleft nose rhinoplasty also as a topic. So like that, we are having Sriharsha and myself. We are planning to give extensive teaching program on rhinoplasty. To begin with, this is the first lecture, so I am just going to the basics of rhinoplasty, and this will be a different kind of a presentation because everybody knows the anatomy and physiology and all. I don't want to go for these that you will get it in the books. But these slides, this is my own slides. I have presented. I have presented hundreds of presentations in India and outside. So these are all practical points I'm talking. So sometimes it will be boring, but bear with me. You will get good take-home points. Slowly, you will understand how the experience will help to give a good result to the patient. Okay, this is one more slide I always want to present or show it in my presentation. Rhinoplasty is art, it is a skill, it is a smartness, and it is a unique surgery because rhinoplasty is not a life-saving procedure. It is not an emergency procedure. It's a unique procedure. Patient will have some expectation. It may be augmentation, or it may be some deviation correction, or some kind of a sharp tip. They want some straight, good-looking nose. It may be a nose block also. So these expectations are realistic. Okay, so if they are realistic, then you can select the patient. Select the patient with, if you are confident, you can select the patient and go. You can post the case. That will come by experience, and you must have a teamwork. You must have your own assistant, your own anesthetist. Ideal situation. Ideally, it should be like that. But most of the time, you will not have your own anesthetist because you will be working in an institution or it will be working in your own hospital. The same anesthetist may not come. Okay, better to have your own anesthetist, your own assistant, and the equipments. You must have your own surgical equipments. You must invest on rhinoplasty instruments if you are really interested, if you really want to develop the rhinoplasty career, then you must have your own set of instruments and you carry those wherever you go and operate. And the surgical techniques it keep on changing. First, you have to learn the basic surgical techniques with your mentor or your seniors. Then you can develop your own surgical techniques. That will come by passion towards the work or passion towards the rhinoplasty. You have to enjoy. You have to enjoy the work. If you enjoy doing more and more surgeries, then it will not you will not get tired and you will be happy to do more and more work. That's what I said, ikigai, the purpose of life. Rhinoplasty is the purpose of life, then you will be enjoying your life. So now you've taken the patient has come to you. The concept of consultation is very very important. You must understand your reputation truly does precede you. Patients already know you. Already they know you before coming to your office. Patients will be knowing about your reputation. They will reach, they will research on your reputation as a surgeon. If you have started your own hospital, your own center as a rhinoplasty surgeon, they will search in the internet. They'll search in the social media or wherever they can search for, and they will have some reputation with you, and then only they will come to you. While doing consultation, you must determine the consultation will determine whether the patient decide to pursue surgery or not. After the consultation, a patient will decide whether to go for surgery or not with you or another surgeon. So that is where the consultation is very, very important, especially the first visit of the patient. As a patient, they come to you for to pursue rhinoplasty surgery. Okay, so but the patients are very educated, tech savvy, and they spend a lot of time on watching, thinking about surgery. You see patient coming directly without watching videos nowadays. Okay, when they come to you, your part of consultation, your thing is you have to identify the red flag signals. What are the red flag signals? If the patient is having more than three expectations, suppose, for example, the one patient will come with a crooked nose, he will say there is a hump here, so we get rid of the hump, one expectation, and if there is having some broad dorsum, okay, there's two expectation, and you want a straight looking nose. These are 3 points. Okay, if the patient is having realistic 3 points, okay, that is a good case. If the patient is having minor changes, they want a sharp tip, you want only 2 millimeter tip, or you want to have only this much of centimeter. If they tell the measurements, then it is a red flag sign, red flag signal. You don't operate if the patient is having imaginary defects or if they're having minor defects. It is very difficult to correct minor defect. If the patient is having broad dorsum, broad tip, okay, and the crooked nose or cleft lip rhinoplasty, these are the cases you can give at least 50% results. Then the patient will be happy. If the patient is having narrow nose and this mild hump, if you want to, he or she want to go to get rid of that mild hump, sometimes patient may not happy after the surgery. Such cases you should be very careful. And if the patient is having body dysmorphic disorder, psychosomatic disorders, then also you should be very careful. You have to identify such body dysmorphic disorder patients during consultation. So during consultation, you have to identify. Then only you will be safe. If you don't identify these kind of patients and you post the case and after doing surgery, they will not leave you. they will come back and they will trouble you like anything. Okay, and the revision cases, be careful. If you are a beginner, I feel don't try to do revision cases in the beginning of your career. You may have joined that loop of revision cases. The patient would have gone to some other surgeon, and or previously there somebody else has would have done something. And if you do the revision cases, the patient, if they are not happy, then you are joining in that loop and you will land up in a problem. Better to avoid revision cases if you are a beginner, if you are doing simple cases. If the patient is having a lot of emotions, a lot of hyperactivity, crying, laughing, or uh, pleasing you too much, there also you must be very careful. If the patient is more ritualistic and is having any relationship problem, like the patient is not happy with the wife or the husband or some relationship issue, then also they will relate the rhinoplasty surgery to their relationship problems. Okay, so don't operate such kind of a patient. They will relate everything to your surgery. And if the patient is having surgery, divers after rhinoplasty, then they will go to a surgeon that after surgery I got divers. So it's very, very difficult. Sometimes it is difficult to handle such patients. You should be very careful when you have to ask all these questions when you have a consultation with the patient. You must talk to the patient. Take at least 30 minutes to 1 hour. I always talk to the patient when they come to rhinoplasty. I will tell the front desk reception to collect the money from the patient. I usually charge 1,000 to 2,000 for rhinoplasty consultation because it is important. It is important to spend time with the patient, right? So if you are spending time with the patient, you have to collect the money from the patient. Time is money. You have to understand if you are doing some good work, if you are helping the patient, you are spending time with the patient for their cause, then you have to charge the patient. And don't see the patient of rhinoplasty without charge because they will ask a lot of questions which are unnecessary. Sometimes they will be read in some internet and they'll come and ask questions and questions. They will not listen to your answers. They will be asking questions. So they are wasting your time. So better you tell the patient to pay the money first and then come. Within 30 minutes, you have to, I will understand whether the patient is doing doctor shopping or he just come for just a time pass or some kind of question they'll ask and go back. So if they are paying, then definitely they are serious. That's why I tell the front desk that collect the money from the patient, then send the patient inside. That will be it makes sense because you will be busy with some other work. Okay, if the patient comes and talks, no, they don't charge, they don't pay you, then it will be, it will hurt the surgeon. Okay, after consultation, now you have selected the patient. Okay, you have a patient is good, patient is having realistic expectation. Then now you have to start the surgeries. Before going to surgery, you have to have something called standardized photographies. You have to take photographs. When the patient comes for consultation, you have to take photographs and you have to keep it in the your own laptop. So basic requirements for rhinoplasty practice or rhinoplasty clinic, you must have a good patent laptop, good camera, mirrorless camera, and then photo, if possible, photography room. These are all ideal situation. Not many people will have this kind of setup, but if you have a photography room, that will be a good thing for a rhinoplasty or facial plastic surgeon. You must have your own headlight, chem headlight, surgical instruments, consumables, and you must read books before going to do the surgery. At least you have to read some good authors. So my mentor also has written one book. I will show you in the next slides. And you must have a good training, exposure, and backup. If you are having any problem in between the surgery, you must have one backup at least. You must have a senior to back up you. An ideal situation will be you must have your own operation room, same anesthetist, same assistant, but it's very, very rare to get this kind of ideal situation. But if you have your own hospital and if you are having your own hired anesthetist and assistant, then it will be a good thing. And you have to have your own checklist. You have to have your own checklist for everything, for case selection and all those things. I will explain in the next slide. Okay, this is the camera I use. This is exclusively for rhinoplasty patients. I use this Canon EOS R10 camera for rhinoplasty patients. I take photographs and I immediately transfer it to my uh, laptop and I edit the photographs and I keep it in my laptop. Okay, so this is how I take photographs. This is a 20-year-old girl came for rhinoplasty. I have taken photographs. So you must observe here. I have taken 7 views here. Okay, this is the profile view or the straight frontal view. You have to have you have to see both the ear pinners. You can see here both the ear pinners and both the eyebrows and the neck and the upper part of the chest and the hair. All these things should be visible. When you take photographs, all these parts should be visible and the background should be pleasant. It should be a light blue or it should be uniform. Then it looks good. This is the profile view or the frontal view. And this is the basal view. You can see here the basal view. You can see the eyebrows are in line with the hairline here. Yes, this is how you take photo. There are modifications, there are some changes, but I take the photograph like this. At least I must see the entire columella. I'm seeing entire columella here from the nasolabial angle to the tip. Okay, and this is the aerial view. You can see here the aerial view will show the dorsal deviations, and you can see the eyebrows here and the eyelashes. You can see here, but you don't see the lower eyelashes here. This is the angulation. And this is the right lateral, left lateral, right oblique and left oblique. Here, I don't see the opposite eyebrow. When you take a photograph, at least if you don't have your camera, mirrorless camera, you can take in the mobile phone also, cell phone also, but don't take the photograph very close to the patient. That will lead to fisheye deformity or fisheye defect. The nose looks bigger, the face, the center part of the nose look bigger, and the other parts will be smaller. So you take a photograph at least 50 to 60 centimeter away from the patient, at least 60 to 70 or 100 centimeter. Then you don't have that fisheye effect. Okay, when there is a background is not uniform, you can edit it. You can edit like this. There is a blue background. This is not a natural one. I've edited these photographs, and this looks pretty and this looks pleasant. And when you present anywhere outside, it looks so beautiful, and other audience or the delegates they'll appreciate if the photographs are good. Okay, this is the Kim headlight I was talking about. This is a headlight I'm using this headlight since almost now 10 years. I'm using this headlight. I have more three headlights with the loop. I use this loop 2.5 and this is very good for rhinoplasty and very lightweight and you can wear it how much ever hours you want, you can wear it. And even I, for the OPD, outpatient and minor procedures, I use this headlight, and it is very useful. If you want to go for rhinoplasty, better you buy one good Kim headlight. And this is the book I was talking about. This is the book written by my professor. This is a 3 volume book. It has a lot of photographs. and it has a QR code, and you can scan the QR code and you can watch videos. There are more than 700 videos. You can scan it and you can watch. Yeah, a lot of videos are there. You can, if you want, I have a few books left with me. If anybody interested, you can contact me. We have 3 or 4 copies left. Anybody want to buy this book, you can buy it, and it's a very good book. A lot of information. The 3 volume book. You can, if you read this book, you will be definitely, it will be going to help to develop your skills and information. Okay, we'll go to the next slide. Okay, this is about that book, and this slide is showing uh, photographs. I have edited these photographs. The background I have edited, and by the Photo Joiner app. The Photo Joiner app is a very useful app. You can join the photographs and you can show your results. This is the pre-op. You can see here. This is a pre-op and this is a post-op. There is a tip drooping or tip blunt tip. With the rhinoplasty, we can make a straight looking nose here. Similarly, you can show the photographs, you can edit the photographs, and you can put in one slide. You can take different angles like aerial view, profile view, or basal view. Okay, and you can show your results. In this photograph, I will show you here. Most of the cases in India, what I have seen, when they come to rhinoplasty, they want minimum or 3 things. They want a straight nose. They want uh, to have a brow tip line. They want to have a brow tip line. From the brow to the tip, there will be light reflex. And they want symmetrical nostrils. You can see here, there is asymmetry and there is a symmetry. So if you give these 3 important things, then breathing, good breathing nose, that is a basic thing. Breathing nose, straight nose, good brow tip, aesthetic line, and the symmetrical nostril. If you give these 3 points, these three results, then most of the patients are happy. Okay, so this is the thing I have noticed in my 15 years of experience. So then, if the patient is happy, generally, then the post-op also they will be happy. Okay, the next slide. I'm talking about the checklist. Checklist. It's very, very important. You have to have your own checklist because lot of the things we will forget. We will forget when you do a rhinoplasty case, you post a case, you will forget to take photographs, you will forget to take proper instruments, and you will forget anesthesia part also. So, my opinion, you must have your own checklist. You can have a printout and you can take out printout and you just tick the checklist for the case selection, for the pre-anesthetic checkup, for the instrumentations, for the consumables, and even for the anesthesia. Anesthesia checklist for rhinoplasty. You can prepare yourself. And then before going to the surgery or before going to ship the patient, you can tick the checklists, just like in ABH protocols. You can prepare your own checklist that will give you a good result and you will be free of tension. So everything will be prepared and it is easy to operate and because everything will be ready. Okay. I want to tell one more thing. I want to emphasize on soft tissue injury. I have seen sometimes the anesthetist, if they are in a hurry, sometimes I'm not blaming the anesthetist, if they will injure the upper lip. When they put the laryngoscope, the upper lip will come in between the lateral incisors and the laryngoscope. That will injure the tip, injure the lip, and sometimes injure the tooth. And they injure other soft tissues in the throat also when they suck the secretions. Okay, so when they remove the packs, so in such situation, patient will not have any problem in the nose. They will not have any post-operative pain in the nose, but they will have pain in the throat. The throat pain is more severe than the surgical pain. So that is where we have to understand, we have to discuss with the anesthetist not to injure the soft tissue or the airway. And you have to have a smooth extubation. Extubation is also important. You have to understand if the patient is violent after, or if they are not coming out smoothly after the anesthesia, after the surgery, the chance of facial grimace and the splints, and sometimes they will remove the splint, they will pick sometimes. Okay, that is why you should be very careful. You have to discuss with the anesthetist to give a smooth extubation. Okay, so that we will discuss it in the next subsequent presentations. I have a topic, anesthesia in rhinoplasty. There is one topic, so we will discuss that, and I will take my anesthetist. I will join my anesthetist in the next subsequent lectures, and how we prepare the case, how we intubate, how we extubate, all those things, on what are the anesthesia medicines we use, all those things we will discuss in the next subsequent lectures. Okay. This is one more concept, occasional rhinoplasty surgeon. I have seen many seniors, they do rhinoplasty and they'll be doing once in a year, or once in 6 months, or once in few years. They are all occasional rhinoplasty surgeons. So most of the time I have seen they will call me in between. They, after the 1 hour of surgery, they will tell that I have forgot to do this. I have forgot to do keep the instruments. I have forgot to keep the suture materials. So like that. So to avoid such problems, if you are an occasional rhinoplasty surgeon, I'm not talking about the beginners. I'm talking about the senior surgeons who are doing the other work like otoplasty, otology surgeries, or some other neck surgeries. They are all interested in rhinoplasty also, but they will do it very, very rarely, once in a year. Then, what to do? At such situation, you have to have your own checklist. You have to prepare the checklist and tick before going to surgery, before posting the case. You have to tick all the things, whatever required for case selection, or for photography, or for prayer preparation. You have to have a checklist. And then photographs, you have to take printout and post it in the x-ray viewer box, or wherever on the wall. And all the seven views, you have to take photographs, take printout. All the patients, all the surgeries, I take printout and keep post it on the wall, on the OT. Then it will give you at least the you will have a orientation of deformities or the corrections to be done, that you will keep on seeing the photograph and you can operate. So that is one more point you must understand when you do a rhinoplasty surgery. The case selection, again, the patient selection is a very, very important thing. If the patient is good patient, if the case is a very good case, then the success rate is almost more than 50%. If the patient is having realistic expectation and the patient is good, then most of the work is done. If you are not aware of body dysmorphic disorder or some kind of a hidden expectation, then it is difficult for you. Okay. Any individual is a potential rhinoplasty case. Any individual. I have seen a patient coming after 60 years, after 70 years. They want to have one more new relationship with some other person. They will come, and they will come for rhinoplasty, and they would have gone for some anti-aging procedures. They will come for, they will have some sagging nose. They want a just lift of the nose, and they come for rhinoplasty. So I've seen many girls, or the middle-aged girl ladies, they would have a dream of having rhinoplasty surgery at the age of 20, 25. but because of so many commitments, family commitment, they would have not gone for rhinoplasty. I've seen some patients come from Australia and other countries. They come at 50 years. They think they want to go for rhinoplasty. Somehow they missed it in their early young age. At least now I have a money, I have all the time and everything. So I have seen such patients also. So that's why rhinoplastic patient can come any age. What is the minimum age for rhinoplasty? This is also more controversial topic, more discussed topic. Last few weeks back, the World ENT Academy WhatsApp group, they have a discussion on what pediatric septoplasty, pediatric rhinoplasty. So there, the lot of discussion happened. We will have pediatric septoplasty as also as one lecture in this webinar series. In my opinion, for the girls, after completion of 15 years, boys after completion of 17 years. That is the safe age to operate open approach septorinoplasty. I have done before also, so I have done surgeries on less than 14, 13 years also, but I have burned my fingers because they will have complications. They have a lot of complication. We will discuss it in next subsequent seminars about that one. Okay. Next, coming to the patient. This is about the patient. When it comes to the surgeon, you must know where you stand in the learning curve. If the patient is having severe deformities, there is some tissue loss, the kind of a cleft lip rhinoplasty. Then, if you are a beginner, I don't think it is a good idea to operate. Okay. Uh, Facial asymmetry, if the patient is having facial asymmetry, that is also one of the tricky situation where you cannot give a straight nose. Okay, when there is a post-septal abscess, severe saddle nose, it needs some kind of implants or some kind of a rib cartilage to augment. Then, if you don't know how to harvest the rib cartilage or you need some assistant, some other surgeon, cardiothoracic surgeon, then take help of the surgeon. Otherwise, don't do on your own because it is like a two procedures and if your speed is not fast, then if you are not doing good fast surgery, then open flap and closure, it will take 4 to 5 hours, and rib harvesting will take 2 to 3 hours. Then it will be more than 8 hours procedure, and it is very, very difficult to keep all the things, resources for more than 8 hours of procedure. It is not a financially not feasible. Okay, so you have to think, you have to plan everything like that. And sometimes the patient will have some other comorbid conditions like epilepsy or some other condition, bleeding disorders. Then you should be very careful when you have a checklist of pre-operative evaluation, pre-anesthetic checkup. Then you have to include all these things in the checklist. Okay, that is about the patient selection. Next, coming to preparation of the patient, the preoperative preparation. That is also important concept. You must tell the patient about the procedure. They must understand the procedure. They must understand that when we are going to operate, when they have to come for admission, when they will have discharge, and when they can join the day, or school or the office or duties. All these things you must well in advance. There you have to mention it in your. You have to give a printout for the patient. Then they will prepare mentally and they will be comfortable going for surgery. And you must tell the patient about the healing process. Healing process is very, very important. It will take 6 weeks to 3 months, sometimes 6 months. They will have a lot of edema when you do osteotomies, when you do some kind of a tip plasty, sometimes they will have polypic deformity. All those things you must tell the patient. Don't expect results immediately. Okay, you have to tell the patient that it will take minimum 3 months for complete 80 to 90% of the result will come only after 3 months. Okay, then otherwise the patient will be afraid when they see you after just splint removal, there will be swelling, kind of a edema. The patient will disappoint and they will come and cry in front of you. I've seen a lot of girls after surgery, after pack removal, after the splint removal, 15th day or 10th day, they will come and cry and they will tell I'm not happy with the surgery. I have to, we have to tell them, well in advance that you will have swelling, we'll have some color change, there's some kind of skin change, all those things you have to tell the patient, otherwise the patient will think that surgery has not gone well. Okay, and then prepare the face. You have to remove the hairs as much as possible. You have to remove the hairs, facial hairs in the male patient and in the female patient. You must see if the patient having big lot of hairs. You must tell the patient to have a two braids and tell the patient to have a head bath because after surgery, 10 days they cannot go for head bath. And before shifting the patient, you have to tell the patient that you have to empty the bowel and bladder. I've seen patients not clearing the bowel and bladder, then after surgery or during surgery, the patient will have full bladder sometimes. After the surgery, when the extubation time, the patient, if they have full bladder, then a lot of problem will happen. The patient BP will increase and patient will not be cooperative, and it is difficult to manage such patients. So this is all, these are the practical points I'm telling. I've seen some, I've experienced these things. That's why I'm just sharing my experience. This maybe sometimes it maybe looks simple, but these are all the important points. Okay. Next, coming to the concept of visualization. So these are all the concepts you have to understand. You have to visualize the surgery. When you shift the patient, when you are ready with the in the OT, the intubate patient is intubated now, the patient is ready for surgery. Before that, when you see the patient, when you see in the consultation office in your office, or when you take photographs, you can visualize. You can visualize the surgery, you can visualize. So this is the quote I always put. The Walt Disney says, if you can visualize it, if you can dream of it, there is some way to do it. That means you have to visualize the surgery, imagine the surgery before posting the case. Okay, when you wash your hands, during that time also I visualize the procedure. What is the plan? What is the thing we have to do? So you decide the type of procedure, whether the patient need a closed approach or open approach, what kind of incision the patient is required, what kind of other procedures the patient may require. All those things you have to visualize before, well in advance, and you must have a blueprint. You must have a blueprint in your mind. Okay, and the chronology also very, very important. When you do a procedure, open approach septal rhinoplasty, you must keep in your mind what is the chronology of the surgery. And when the patient is intubated, we use a South Pole REA tube. They should be in the midline. The tube is in the midline, and you ask the anesthetist to put the throat pack. And when you do intubation, the tube should not pull the angle of the mouth. It should not deviate or it should not pull the nose to one side. So this is very, very important. And you must protect the eyes and hairs and soft tissue all around the nose. So I usually put a 1 inch plaster around the eyes and cover the eyes, so that post-operatively I have seen many patients will have a foreign body sensation, sharp pricking pain in the eyes. That may be because of some kind of sometimes there will be some kind of small particles. Some people use for plaster of Paris (POP). That plaster of Paris will go inside the eyes and they will have a lot of burning sensation and foreign body sensation. Surgery will go on well, but after that, if the patient is having some kind of foreign body sensation in the eyes, they'll not sleep in the night and they will not allow you also to sleep in the night. They will keep calling you. So that is why I always cover the eyes completely and I'll drape the nose and the face. And then I do all the other procedures, infiltration, incision, flap elevation, all those things, and I harvest the costal cartilage. I do osteotomies. Very, very important point I'll tell you now. Osteotomy is a very, very important step in the rhinoplasty. When to do osteotomies? That is a point here. So when you do a septoplasty, when you want to harvest the cartilage and there is some problem in the lateral wall of the nose, if you want to do some endoscopic sinus surgery or some turbinoplasty, some kind of a endoscopic middle meatal antrostomy, something like that, you do it well before uh, osteotomies and diplasty. Because after doing osteotomies, if you do all these procedures, it will take 1 or 2 hours extra. In that time there will be edema will set in. There will be edema around the lateral wall of the nose and that will lead to nose will look bigger, and that edema when increases, and then lot of ecchymosis, bleeding, all those things will happen. And after the completion of surgery you will not able to identify the post-operative results. That's why should be very careful and try to finish the surgery as early as possible within 2 to 2 hours. You have to train in such a way that you must finish rhinoplasty within at least 2 hours. Like that, you have to plan. If it is a little difficult one, you can take 1 more hour extra. If you do like that, it will be a good thing for every anesthetist and your OT staff. Everybody will be happy. And edema, if sets in after 2 hours, when you do osteotomy, the edema will sets in and you will be tired. You will be tired, and it will be very difficult to maintain everything after 2 to 3 hours because everybody will be tired. That's why, my opinion, better you improve your skills to finish the surgery as early as possible, at least 2 hours, 3 hours, like that. Okay, this is about the osteotomy chronology of the surgery. Next, then next thing is the grafts. You must plan the grafts. You must what are the grafts you must need. Sometimes whatever cartilage available in the septum, that is enough for reconstruction of the septum or augmentation. If you are doing some saddle nose or some kind of a reconstruction work, then you have to have a revision rhinoplasties. There will not be any septoplasty. SMR cases, there will not be any cartilage left in the nose. Then you have to harvest rib cartilage. So how to harvest rib cartilage? The rib cartilage rhinoplasty is one more topic. I want to have a one more lecture on rib cartilage harvesting and rib cartilage rhinoplasty. That is one more topic. It's in my mind. In the next subsequent lectures, I will present that one. With the experience and with the guidance, you will understand the surgical plan. You must know what is the approach. So if there is only the external valve obstruction, then no need of open approach. You can just make a pocket and you keep some punctal cartilage, that will be enough. So this is how you must plan the surgery. Not all the cases require open approach. Sometimes only the hump is there, then you can make a pocket and just rasp it. So like that, you must have a surgical plan. You must have a surgical approach, and what kind of graft you want to use. That all blueprint you must have in your mind. And whatever cartilage you keep in the nose, it should be fixed. You have to fix it with the 50 PDS, and you must make pocket in such a way that it should not slip off, it should not displace, and it should not be exposed out to the external environment. It should be sandwiched between the skin and the mucosa. The skin and the mucosa. All the whatever graft, whatever cartilage you keep inside the nose, it should not have any sharp edges. It should not have any sharp edges. You have to fix the graft. If there is any sharp edges, and it will necrose the tissue, necrose the skin, necrose the mucosa, and the cartilage will come out. So like that, there's so many things. These are all my experience. This is all after so many years of my experience. I have created. I have made these slides, and this is all working for me. Okay. Next, coming to the instruments. part, you must have your own instrument. Ideal situation. I am talking about the ideal situation. If you are working under somebody or if you are working in other hospital, then it may be difficult to have your own set of instruments, but ideal situation, you must have your own set of instruments. I have my own set. Now I have two rhinoplasty sets and another two septoplasty sets I have with me. And if required, I have a standby sharp scissors and rasp. I'll keep in my bag wherever I go. I operate in my own hospital. No need to worry because my assistants, my staff will take care of it. When I go to other hospitals, other center, then I have to carry everything. So my assistant will be there. My staff will take care of all those things. So you must be ready with the rib harvesting set also. Sometimes there will be surprise. Sometimes you will not get enough cartilage in the septum. If you need a good strong cartilage, then you may have to harvest the rib cartilage. So you be ready and take consent with the patient. Take the consent of the patient. If required, we will harvest the rib. Okay. And if the minimum cartilage is required, you can always go for post-oral punctal cartilage harvesting. Okay. So this is about the instrumentation, coablator, cautery, all those things. If you have in your own setup, then it will be a good thing. Okay, fetch instruments also. Fetch instruments, most of the time, we will forget. If the patient is having some conchobulosis or some turbinoplasty, some kind of polyp, then always better to do it in the same setting. A basic fetch. I'm not talking about extensive polyposis, extensive fungal sinusitis. Don't operate with the rhinoplasty. If there is some kind of conchobulosis or some turbinate hypertrophy, always you can do it. And I do lateralization, I do fracture and lateralize the turbinate almost all cases. Okay, this is the picture showing osteotomies, humpectomy, osteotome, rasp, needle holders, and cartilage forceps. All these are very, very important for rhinoplasty. I will do one more lecture on instruments on rhinoplasty. This is also in my mind, and myself and Dr. Harsha, we have a series of lectures. We have planned it. So the instruments on in rhinoplasty, that is one topic. We will discuss some other time. Okay, coming to the surgery proper. When you operate on a patient is intubated. Now you have to divide the nose into three surgical subunits: upper one third, middle one third, and lower one third. So whenever you operate, you have to see the deformities in the upper one third, you correct it, and deformities in lower one third, correct it, and like that. Middle one third, lower one third, like that. You have to divide the nose. It will simplify the procedure, surgical procedure. So upper one third, if there is a bony framework deformity, you can do humpectomy or osteotomies. In the middle one third, you may have to do something like a spreader graft, and the lower one third, you have to do the tiplasty or allar reduction. Like that, you can plan the surgery. You can divide the nose into three subunits. Okay, this slide is showing the nasal vaults. I will skip this. And this is one more concept you must understand: the nasal subunits. This is useful when you do reconstruction rhinoplasty. When there is a tissue loss somewhere in the ala or somewhere in the lateral wall, there is something like a basal cell carcinoma. When they resect entire part of the lateral wall, then how to reconstruct the nose? Something like that. Okay. So this is again reconstruction rhinoplasty is one more topic. We will do it at the end of the webinar series, but because that is the ultimate thing you must know as a rhinoplasty surgeon. Reconstruction rhinoplasty and the vascular collapse, all those things we will discuss at the end of the second series. Okay. Then the coming to the histology of the skin, this is very, very important. When you do a flap elevation, where is the plane? Where is the plane? The plane is at the supraperichondrial plane. When you are on the cartilage, you are on the supraperichondrial plane. And on the bone, when you go on the bone, it will be periosteal plane. This is a periosteal plane. Okay. So when you on the bone, you must go in the subperiosteal plane. On the cartilage, you must go in the suprapericardial plane. And if the skin is too thick, how to reduce the thickness of the skin? You can resect the deep fatty layer, this one, and try not to injure the superficial fatty layer or the dermis and epidermis. If you do it, then it will lead to occurring after the scar. There will be a lot of unwanted scar. So better not to injure these layers: epidermis, dermis, superficial fatty layer, and smash layers. Smash layer is also important. Okay, so whatever vessels and all, that will be somewhere here in this plane. Fatty layer, this you can resect. If the skin is thick, you can resect it and make the skin thin. It's coming to the incision part. The incision, the transcolumnar incision part. The incision, there are different types of incision.